Welcome back, you guys. I'm so excited for today. We have Miss Aimee Raupp with us today. If you are unfamiliar with who she is, I'm sure a lot of you all know who she is. She is the author of multiple books, one of which is The Egg Quality Diet, which is a book I dove into right after my miscarriage and has been a staple piece in our home and our diet ever since. You are a wealth of knowledge. She has an online presence, so highly suggest following her. But would you like to introduce yourself?
Sure, sure. Thank you so much, Adelaide, for having me and for doing all that you do for the community. It's
Oh my
very
gosh, thank you.
no, but I mean it. I think when the warriors really step up and support each other, it's amazing. So thank you. So yeah, I'm Aimee Raupp. I've been in clinical practice as an acupuncturist and herbalist for 2 decades, actually going into my 20th year this year. So that means I have a master's of science in traditional Oriental medicine. But prior to that, I am I guess I would say, a self-proclaimed medical school dropout. So I have a biology and chemistry degree. I have degrees in neuroscience. I'm a bit of a nerd, and I love to dive into the research, and I love to look at the body holistically. And I would consider myself, what I do as a fertility detective. I'm really trying to pull back all the layers of the onion to figure out what is the root cause of these fertility challenges. And what I have seen in 2 decades of experience and helping, literally, I've helped thousands of babies come through, which is a huge honor. Is that our fertility is an extension of our health, and our health is mental, it's emotional, it's physical, it's nutritional. And so, yeah, my latest book, The Egg Quality Diet, really helps reset that physical inflammatory process that is most likely compromising egg quality and or at the root of a lot of fertility challenges, right? I know you and I were speaking offline about it, but things like endometriosis, adenomyosis, those are really common causes of unexplained infertility, which I
Mhm.
do air quotes with the unexplained, because they're definitely, there's always an explanation, guys. There's always an explanation. Um, but there's these inflammatory systemic processes that are going on in the body, when whether they have a diagnosis or not, that are typically causing compromised egg quality, compromised uterine health, compromised blood flow to the ovaries, to the uterus, to other parts of your body, that are rendering you less fertile than you could be. And so we're really trying to go after that inflammatory process to help restore fertility.
Preach, preach. Since the day I went to my OBGYN and they're like, oh, we don't know what's going on with you. Then we did a bunch of the general blood work and we're like, you have unexplained infertility. I was like, that's bullshit. Like
Yeah.
there's no such thing
Yeah.
as unexplained infertility. There is a root cause. We just got to figure it out. So, for someone who is sitting here listening right now that has been told they have unexplained infertility and maybe they've gone to their general OBGYN or a fertility doctor, whatever that may look like, and they've just been slapped on with the title of unexplained infertility, but they want to figure out what's going on, what would be your first steps for that?
So, I mean, first, I would always have questions, but if you are dealing with health challenges, so like outside the scope of fertility, maybe you have joint pain or regular headaches or dry skin issues or eczema or psoriasis or GI issues, like you get gas or bloating, or you vacillate between constipation, diarrhea, even more painful periods, clotty, heavy periods, irregular periods, spotting, like any, like what I would call red flag or kink symptom, that's what I would go after addressing. So, because
Mm,
that's me, the way I see it, and I think a lot of people see it this way, is it's the body speaking, saying I'm out of balance. And so
mhm.
the body, when out of balance, when burdened with other maybe disease processes or inflammatory processes in the body, it will not prioritize fertility. So fertility, and I say this very clinically, not, I love all you guys, and you guys all deserve your child. But very clinically, fertility is a luxury. It's the body saying, I have enough resources to go and make this human, because getting and staying
Wow.
pregnant is actually the biggest human feat that we can accomplish. And so the
Yeah.
body needs to know that it's safe, and I don't mean like not in a war zone, but like physically safe, getting all the nutrition it needs, getting all the rest it needs, all the recovery it needs, healing all the other things that are going on. And so that's really why I wrote the Egg Quality Diet. I think that's a really good starting point, and I know for many it's challenging. You've gone through it, so you could share to that too. But It's a 100-day elimination diet where you do get to reintroduce all the foods you've eliminated. It is not a forever restrictive diet. It's meant for you to figure out what's working for your body and what's not.
Mhm.
And food really is the primary medicine. And then I would, the resources page that comes with the book has a tremendous amount of information from the mental emotional container as well. So that's probably where I would start. I would also, and we can share this with your listeners. There's a list that I have of like the absolute necessary fertility lab tests that really have nothing to do with your fertility, like your thyroid, your vitamin D, your
Mhm.
homocysteine levels, your iron, that just gives us a full check on you. And typically when we do that, we figure out what's going on. When I was writing Yes, You Can Get Pregnant, which came out in 2015, which was my first fertility book, because of my nerdy nature, looking at all the research and trying to understand, in the stats, it comes up pretty clearly that about 40% of unexplained infertility is actually due to endometriosis. And endometriosis is super hard
Wow.
to diagnose unless you do a
Mhm.
lap. Some will do a pelvic MRI, but a laparoscopic surgery is typically how you diagnose it. And some women can have no symptoms, right? And they can be
Mhm.
covered in endo. Some women can have a small amount of endo and have tons of symptoms. So it's a very suspicious disease. Sneaky, I think is a good word for it. But then also diving deeper into the research, you start to see correlations between celiac disease, between Hashimoto's, polycystic ovarian syndrome, of course, but you start to see these. What I would call like low lying or undertreated or mismanaged or not identified at all autoimmune conditions that are actually at the root of the challenge. And so
Mhm.
working on those, and it doesn't always have to be celiac. Celiac only really affects 5% of the population, but a
Oh, wow.
large portion of the population is impacted by non-celiac gluten intolerance. I am one of
Mhm.
them, and it took
Me
me
too.
25 years to figure that out. And I suffered severely with bad periods, acne, eczema, asthma until I really figured out my diet. And I was probably in my mid to late 20s, which is why I'm also such an advocate. I did go through it myself, meaning chronic health issues, to then figure out diet was at the root of it. And then, of
Mhm.
course, mental emotional stress. But so I know that's a long winded answer, but I would
Mhm.
just take a step back and be like, okay, they're just looking below the belt. They're looking at my age, they're looking at my FSH, looking at my AMH, my antral follicle count. That's it. That's all they got, right?
Mhm.
Maybe they're looking at sperm. They might not even be looking at sperm. And that's another thing we should definitely be looking at
Right, that's
um,
wild.
right away, and so upwards of 50% of fertility challenges are male factor. And I would say probably 30%, in that all overall 100% are an overlap between male and female factors. And so
Wow.
it's just kind of getting it all figured out. And then I also think, and we were talking about this before we went live, there's ways to break it up of like, yes, we could look at hormones, yes, we could look at egg quality, we could look at sperm quality, but we also always have to think about the uterine environment, which I think is something
Mhm.
that doesn't get looked at until we've had like multiple failed IVF transfers, which
And
is
why is that?
I
Why
have
is it
no idea.
something that's not well known in the field? Why is it something that doctors aren't looking at, especially after miscarriages?
Mhm.
I mean, it took me I had a miscarriage in July of 2020. I didn't find out I had endometritis, which I suspected I had it probably
Mm,
right after that
we
miscarriage
did.
until the beginning of 2022.
So yeah,
Like,
let's
why?
first define. So for everybody listening, there's endometritis, ITIS, and there's endometriosis, OSIS, two very different conditions. Endometritis is an infection of the uterine lining, which
Mhm.
is typically treated with a course of antibiotics. But if you have that infection, which is diagnosed via an endometrial biopsy, which I've had one or two done, I think, after my miscarriage too. So I can speak to it that I didn't think it was outrageously painful. It wasn't like, oh yeah, sign me up for another one of those. But I've had a colposcopy, I've had PAPs, like all of us have had, and it was in that category of discomfort. But they
Mhm.
can take a snip of your lining and they send it off to pathology and they test it for bacterial infection. If you come back positive, which the research is showing, 50% of women who are tested actually come back positive. 50.
Wow.
50. So I think we have to put this in the
Wow.
category of like, this is a huge reason for this unexplained infertility. And it can
Yes.
happen Sometimes it just spontaneously happens, like the uterine microbiome is off, which is also why I think my work works, is I'm healing the gut microbiome, which will in effect
Mhm.
heal the uterine microbiome, right? We're like reestablishing the microbiome, which then makes the uterus more hospitable. Maybe that was the issue all along and that gets healed.
Mhm.
But it also happens though postpartum, like postpartum, sorry, post delivery. Any intervention in that uterus could cause an infection, could introduce a bacteria. So a DNC, if you've had a DNC because of a miscarriage, if you've had fertility treatments and they've gone in your uterus, like IVF or even IUI, if you've gone through labor, for certain, you can have it. And so, why they don't test for it, I mean, who in God's name knows? But like I see now, there are some fertility clinics that now won't do transfers until they rule it out, which is great. And I
That's
basically
amazing.
have a hard rule with all of my girls. Like I have, you worked really hard for that embryo, whether you have 10 on ice or one on ice, you worked your ass off for them. We are not
Mhm.
transferring them into a uterus until we know that that uterine environment is clear of this infection.
Yeah.
And so, I get the feedback from doctors as to why we don't always go in and test. Some will say, but doing the biopsy alone can actually introduce a bacteria. We could cause an infection.
Mm.
Some will say if we look for problems, we'll find them. Some will say insurance doesn't always cover it until we've had multiple failed implantations. I don't want to put that
Oh.
burden, that cost on the patient.
Oh my
I
gosh.
I to that say that's not your decision to make. This girl's been through
Yeah.
hell and back. You don't think she'd want to spend a couple $100 to figure this out? Like I paid out of
Right?
pocket for the biopsy. I think at most it'll be
Yeah.
$300 in, but even a hysteroscopy, which is where you have to go under anesthesia, they put a scope up your uterus. It's much more diagnostic than a saline sonogram, which is typically what they'll do. And they go in with a camera and they can find adenomyosis, they can find scar tissue, they can see signs of endometritis because it does look
Mhm.
different on the visual. And so, in my opinion, every woman who's been trying to conceive for upwards of 6 to 12 months without success or has had multiple losses, first line of defense for diagnostics should be a hysteroscopy with an endometrial biopsy. And that's just 20 years of clinical experience talking. I know a
Yeah.
lot of people will be like, that's super aggressive, yada, yada. And it's like, I tend to err on the side of caution because fertility challenges suck. And no matter you've been here for 2 years or 1 year or 3 months or 10 years, like you deserve to get answers. So
That's
anyway,
something
and
I
endometritis,
wish
go ahead.
sorry, that's something I wish I would
Um,
have known early on. I really wish I would have front loaded all the testing
I
in our
know.
journey because it's something that I felt like I was digging and searching and having to really advocate for myself because, the doctors weren't really, and I was learning from other people online and kind of just bringing what I was learning to them. And sometimes they would dismiss it. Sometimes they'd be like, oh, let's test it. So if you would take, I mean, I hope anyone listening, you would know this, but taking any advice from me, it is front load those tests, get everything done that you possibly can because we've now been sitting here 3.5 years still trying. We didn't learn I had endometritis till 2 years in. Like, I mean, I just think of what could have happened. I mean, even endometriosis, like I was dismissed in my teens from endometriosis pain. Anyways, is there any symptoms that come with endometritis that you've
Not
seen
necessarily,
consistently?
not necessarily, which is
Oh,
upsetting. Um, yeah. So, and endometritis. So some docs will say, I won't treat it, but I'll give you a 10-day course of doxycycline, which will, or I won't test for it, but I'll give you a 10-day course of doxycycline,
that
which will
happened to
treat it.
me.
I'd go for that if that was the option. I am very much in line with don't take no for an answer. This is your body.
Mhm.
This is your time. This is your resources. You just tell that doctor, if you're not going to do it for me, I will find someone who will. Thank you very
Preach.
much. Um, I have found that Kind Body. I know they're popping up everywhere. They're like a franchisee fertility kind of center. I don't know how well their IVFs are run. I've heard mixed messages, but uh, any of my women in the United States whose doctors are pushing back against testing, if I get them to a Kind Body will do all the testing, just so you guys know. And
Wow.
they work well with a lot of insurances. So that's a good place to start, even if you don't do fertility treatments with them, but you just say, I suspect I have endometritis, or what about, and I also will arm my patients, and it's easy for you guys, just quick Google search endometritis, ITIS at the end, not osis, endometritis and implantation failure or end infertility. You will see a boatload of current research papers. take those papers and show them to your doctor and just say, this is what I've
Mhm.
seen. I want to be tested for this, and you push for it. You
Mhm.
have to push for it, unfortunately. And endometriosis, there's like a belief system in and I've talked to my fertility doctor friends about this, so it's not like I've decided this is a belief system. This is what I've heard from them, that as they're taught in medical school, that they used to diagnose. So there's a difference between two of the doctors that I work closely with. One is about 10 years older than the other. I won't name names. And the one that's older, when he went through medical school, we diagnosed for endometriosis. We went in, we did laps. If we suspected it, we treated it. 10 years
Mhm.
later, Dr. B goes through medical school. We don't test anymore. We just push them to IVF because IVF solves for endometriosis, which is not true. It
Yeah.
can if it's causing structural impedance, like so the tubes are blocked or the ovaries aren't functioning properly because because endo kind of grows, endometriosis now we're talking about, which is an inflammatory systemic process. It is not just endometrial tissue growing outside the uterus. It can grow anywhere. I've seen it on lungs, colon,
Mhm.
ovaries, like appendix. Like I had a girl with chronic appendicitis, only for them to go in to realize she was covered in endometriosis. And
Yep.
that's why she was having this chronic appendicitis. So her appendectomy turned into a full body, and she'd stage four endo, stage four endo.
Mhm.
Um, so, but endometriosis in a lot of doctors' minds is just treated by pushing the patient to IVF. But then what can happen with both endometritis and endometriosis is implantation failure, because
Mhm.
this inflammatory process or infection can prevent the embryos now from implanting. So there's lots of ways to go about it. I do see that. This is one thing I say clinically all the time. When I treat endometriosis, like an autoimmune condition, it often responds well, which is why like the egg quality diet is like the right thing for you, Adelaide, or anybody that's listening with endometriosis. It's not easy, and it is a lifestyle overhaul, but it's so worth it. I've never had a girl come back to me and say, this was the
Mhm.
worst decision. I'll never, it's like they're always like, oh my gosh, I didn't know I was
Amazing.
walking around with brain fog. I
Mhm.
didn't know I have headaches every day. I didn't know I had, diarrhea on a regular basis, like, or whatever, that it was impacting me as much as it was until, and then oftentimes it takes time to heal that. So the options with endometriosis are we could do a laparoscopic surgery and remove, and then the slate is clean. We'd still have to come in with a diet and lifestyle. We'd have to. We can do 1 to 2 to 3 months of suppression of Depo-Lupron, something like that. That will suppress the endo. Again, a clean slate. You still have to come in with diet and lifestyle to prevent it from coming back.
Mhm.
Or you go the au natural lifestyle route and you do that for upwards of a year and a half to 2 years. That's usually about the time where I see the shifts start to happen in my patients. We don't
Oh,
know the
wow.
stage of endo they have because we didn't ever go in and diagnose it fully. Um, but yeah, I think it still all comes back to healing the gut, healing the nervous system, and like, from a Chinese medicine perspective, almost like retraining the body of like where to put its resources, or where to I don't know, focus its attention on healing. Like, so endometriosis from a Chinese medicine perspective is just like almost like a template miscommunication. Like things are just
Hmm.
not um your body's not being told where to put, this endometrial tissue, and it's kind of it's confused, if you will. And so
Mhm.
it's really about like teaching the body how to relearn how to I don't know, how to come back to
Function
homeostasis.
properly.
What'd you say?
I said function properly, right?
Yeah.
I am a huge component of Chinese medicine, acupuncture, doing everything more on the holistic side, as well as I think Eastern and Western medicine both play a huge role
Yeah.
in fertility, right? So, what are things outside of diet that we can do for our fertility, that you can do for people who have autoimmune diseases, endometriosis, et cetera, et cetera?
Yeah, so I mean, it's a whole lifestyle component, I think. So I mean, diet, I always say food is primary medicine.
Mhm.
But then there's lifestyle. So it's sure acupuncture, anything that's going to improve circulation and blood flow is going to help the body heal and help reduce the inflammation.
Can you
So
explain why that is? I get that question a lot. Like, can you explain why does acupuncture help? Why does lowering inflammation in your body help your fertility?
Well, inflammation sets off oxidative stress. Oxidative stress is the reason that we age prematurely. Oxidative stress compromises cellular health, which will compromise egg quality and sperm quality, uterine environment, ovarian function. It also puts a great demand on the body. So there's the body's under stress because it's trying to get rid of all this oxidative stress, which is basically like in my first book, Chill Out and Get Healthy, I say oxidative stress is kind of like rusting. You know, if like a car sits outside for a long period of time and just starts to, like the older cars, they would just like rust. I went to grad school in California and everybody has really old cars out there for some reason. And you could just see this like aging process like happening on the cars. And maybe that's why it was in my head. But when that burden is on the body's saying, I got to put out these fires. Like, I have to, why is my body prematurely aging? So then it'll put fertility on the sidelines because it's like, I have to put out these other fires. But it'll also, it puts a huge load on the overall system. You're kind of more in like fight or flight versus you want to be in rest, relax, and reproduce. So the nervous system is out of whack. That could cause FSH to go up. That could cause estrogen to go down, testosterone, DHEA, all the things. DHEA is our aging hormone. That'll decline
Mhm.
if the body thinks it's aging prematurely or it is aging prematurely. So reducing inflammation really is at the crux of all of it.
Mhm.
And inflammation comes at us in so many ways, right? Not just diet, but I talk about this in my book Body Belief, but emotional inflammation, that's our stress load. Like that's our thought processes. And not to say stress is causing your fertility challenges, but it's not helping. And if you're in
Mhm.
a chronic state of fight or flight, then you could have the perfect diet and take all the right supplements and do acupuncture every week and Chinese herbs and castor oil packs and, move your
Mhm.
body in the right ways, and you're still not going to get ahead of it. Regulating the nervous system, calming the nervous system, getting that body, fight or flight is normal and should exist, but we do not want to be there 80% of the time. We want to be there like 20 or 30% of the time. The rest of the time, we want to be in this state of like giving your body the signal that it has all it needs. And
Mhm.
um, so then things like modalities like acupuncture are really good at I always say it's like a reset for the body. So it's bringing the body back to homeostasis, calming the nervous system, helping with blood flow and circulation. So what we know, like right, that from fertility perspective, the inflammatory processes, like I explained, will cause like premature aging and compromise cellular health. The other huge part, and endometriosis plays a big role in this, is compromised circulation and blood flow to the ovaries and the uterus. If we're not getting the right amount of blood flow, your ovaries are not going to be functioning the way they should. And your uterus is going to
Mhm.
be kind of like cold and stagnant. That's how we would see it in Chinese medicine. So
Mhm.
we're really about getting that proper blood flow and circulation to the ovaries and the uterus so that they can function better. And you'll see that
Mhm.
oftentimes, right? Even with just doing acupuncture regularly, you'll see, because it has such an impact on the nervous system, you'll see FSH start to come down. You'll see AMH improve because you're harmonizing the body. And then it's also, how you live your life will dictate your health, right? And even the thoughts you think dictates your behavior, which dictates your health. But you could be following the diet but not working on the nervous system piece, and so you still might be compromising like your absorption, so then your gut health still isn't going to improve, right? We know the gut brain is super connected.
Mhm.
So it's a multifaceted approach, if you will. But things that I love to do with my patients, especially if they are symptomatic of endometriosis, is I'm going to use Chinese herbs, I'm going to use acupuncture, I'm going to use castor oil packs, abdominal gua sha, like, and I have tools, recommendations on how to do all these, like anywhere on my website. Just Google my name and the word castor oil or the word gua sha, you'll find it all. But so we'll come at it, and then also looking at exercise, like, are we over exercising, are we under exercising? That plays a huge role again in the nervous system piece. Sleep,
Yes.
like, are we waking up feeling rested? Are we getting to bed before 11 p.m.? Are we limiting our blue light exposure? What are we doing, like bath and beauty products? How toxic are those? Like, we know for certain the chemicals in our bath and beauty products are endocrine disrupting chemicals. We know that that's
Mhm.
very well documented in the research. We also know most of them are disruptors to hormones and to fertility and reproduction. let alone also most of them are cancer causing too. So limiting that exposure
Mhm.
again takes another burden off the body. And it just, it's almost like then you just start to kind of calm the nervous system and calm the body back into this space of feeling safe and feeling secure. And I think with that, then you're improving fertility, whether or not you're even going in and like surgically removing endometriosis, you're calming it. You're maybe not curing, but you could be healing. And I always see fertility as a spectrum of like, it's not an on off switch. It's more like maybe you're at 20% and we just need, like for you, maybe you just need to get to 60% and you'll get pregnant. For someone else might need to
Mhm.
get to 80. Someone else just need to get to 30 and make a couple shifts, right? It depends on, what's going on inside too. But I always
And
think it's like, yeah,
to be clear,
yeah.
this is not only for those of us that have endometriosis, right? Like
Mhm.
acupuncture, lifestyle, all of that can be extremely beneficial
Oh.
for anyone's going through fertility and just to feel better too,
Well, that's
right?
it. And I feel like too, like one of my favorite parts of my job as an acupuncturist, which I only do 3 times a month now. I used to do it 8 times a month, 10 times a month, um, is supporting my clients, right? So like I'm in there, I'm knowledgeable about what's going on the Western side of things and all their fertility treatments if they're doing that or their cycle and all those things, but holding space for them, letting them know they have another team member who's like,
Mhm.
cheering for them. And Chinese medicine is beautiful. Like we really believe that if we just get the body back in harmony, we adjust lifestyle so that you're living in accordance with the Tao. That's how we see it, the Tao Te Ching, and that means like in harmony with nature and listening to the seasons. And there's certain lifestyle practices for each season, for each age. We see women being able to procreate well into their late 40s. And now with the
Wow.
advent of more modern technology, I mean, there's so many cool things going on in the world of
Right.
fertility. I think we're extending fertility into the 50s. Not that I say people should wait that long, but like
Mhm.
it's really cool to see. I see 48, 49-year-olds getting pregnant right now with their own eggs. And so
Wow.
I think that's more hopeful for all of you guys that are younger. But yeah, it's not just for endometriosis. I think we can make an assumption. I make the assumption that most of my unexplained infertility cases have some sort of inflammatory process going on, if we want to identify that as endo or
Yeah.
not. But that's how I always treat from that space but you can also just see it. You can see it in overall health. And most women who come to me, aren't in, their health is decent, but they're probably functioning at like 60, 70%, maybe
Mhm.
80%. And so we're just slowly shifting that. And anything you can
Mhm.
do to regulate your nervous system, anything you can do to improve your nutrient absorption, anything you can do to reduce your toxic exposure is going
Mhm.
to amplify hormones and basically put your body back into that state where it's like, yes, reproduction is a possibility for me versus I am
Right.
just trying to get by.
Right. And I know it can be really overwhelming for those of us that are going through fertility struggles and trying to figure out like where do I begin? You kind of feel alone. You're trying to figure out like what to switch out, what to do, and it can feel very overwhelming. And I mean, I've been doing this 3.5 years, and it's been a long road of figuring it all out. Switching out products, all of that. And I just want to hone in on here. It's not about being perfect. You're never going to live 100% toxin free life. It's impossible, unfortunately. It's impossible. But that's also like something to feel relief about.
Mhm.
Like Aimee, you're saying here, it's all about lessening the toxin load.
Yeah.
And then
Perfection doesn't
obviously,
equal pregnancy, right?
right, exactly, which is I think that is very reassuring because I feel like people get overwhelmed because they think they have to do everything,
Yeah.
right? When the reality is lessen your toxin load.
Yeah,
Don't
slow and
try and
steady
do it all.
wins the race. So even with my girls that, sign up to work with us and they invest a lot into the program, but I let them run out of their supplements and we change to new ones. I let them run out of their bath and beauty. I always say I respect your money.
Mm,
And also then there's some who are just like, but I love this one eye cream. I just can't let go of it. I only use it once a week. I'm like, then by all means use it. Like that's fine.
yeah.
Same with me. Like for years, it took me forever to find like the right non-toxic deodorant for me. And I finally found
Mhm.
it. But all those other years when I had to go to the clinic, and I didn't want to smell or have sweat marks, I wore
Mhm.
Dove deodorant. And I always would joke, if that's going to be the end of me, like, then so be it. Do you know what I mean? Like,
Right,
if that's
right.
my one toxic thing. And so it's even like with coffee or with alcohol, I think everything in moderation. And I think really understanding how to consume these things versus this full on avoidance, where I
Mhm.
think that creates even more stress and burden.
Oh,
And it
yeah.
leads to sabotage, it leads to burnout. And you guys are you know, you're in a club you never wanted to belong to. So it's like we have
Mhm,
to honor that. And but
mhm,
also these changes, like I will always say this. I will recommend anyone that I know and love, whether they're trying to have a child or not, that they should be non-toxic with their bath and beauty products, that they should,
mhm,
avoid plastics and like fragrance and that kind of stuff
mhm,
because when you do the research, it's scary. I'm not going to lie.
mhm.
And do I think that the toxins in our environment, including the pesticides and the chemicals, are the leading cause of fertility challenges? Yes, and because they're also triggering
Wow,
autoimmunity and inflammatory processes.
wow.
So, I mean, it has to be. You look at the stats;
Yeah.
it's just like, what else could it be?
Yeah.
What else
Well,
could
and
it
that
be?
that it's so frustrating too because even then, that's not like what people doctors are coming out and telling you either, right? I feel like if more doctors were transparent, reading the research, sharing that, it would be such a different world we would live in and it wouldn't be I almost feel like sometimes I'm taboo when I'm
Yeah,
talking about,
I know.
lessening the toxin load and like different products I'm using and like I'll get DMs all the time of like hate being like, "Are you kidding me? You're like scaring people, blah, blah, blah." And it's
I
like,
know. Same.
you go do the research. You go look into it. It actually is very scary, and I wouldn't
It's scary.
be a good human without sharing what I've learned. I mean, my mom is 61 and she's learned through me, toxins, all of that, and she's switched out so much in her life and she's now sleeping better. She's
Yeah,
feeling better. The
100%.
dark circles are going away. The fine line. I mean, it's just crazy to see that, as someone who is so much older. Like, she's obviously not doing it for fertility, but just for
Right.
overall better health and she's
That's it.
feeling it.
That's it. And it's just, the manipulation of our food and our environment,
Mhm.
it's hard to completely avoid them in our current environment. We're not going to do it, like you said. And so
Right.
what I always say, like I say two things constantly: perfection doesn't equal pregnancy, but also it's frequency and consistency. So it's
Yes.
even if you do it 60, 70, 80% of the time, all the time, it's gonna move the needle.
Mhm.
What's hard is most people, obviously you don't want to be here first, so that's very hard.
Mhm.
Second, we just want that quick fix. I just want to take like
Mhm.
the DHEA and it fixes everything.
Mhm.
Or I just want to, do the IVF. And like that's the thing of like IVF isn't a guarantee. Like none of this is guarantees,
Right.
which is also really hard. And so and I think really, a big part of the work that I do now, I have a clinical psychotherapist that's on my team now. We really address the trauma and not from
Mm.
like I love mindset work. I've done so much of it myself and I love to talk everybody through beliefs and how to shift them and things like that. But I'm not a psychotherapist. And so now
Mhm.
having someone who's trained in trauma work with our girls, it's so transformative. It's
Wow.
so helpful because that's the other thing too that I think is maybe underplayed or not discussed enough is that what you are going through is real trauma. And,
Mhm.
it has to be unpacked at some point. You can
Yeah.
unpack it after you have baby if you want, but a lot of times if we want to get that nervous system piece down and get your body regulated, we need to look at that trauma now. And a lot of people
Mhm.
that I find that's the hardest part to look at. It's much easier to change supplements, much easier to change out bath and beauty products. To unpack that trauma piece is hard. It's hard.
Yeah.
And so I also take that really seriously in my work. Not that others don't, but I just mean from a mental health perspective. You can't underestimate it, and that level of emotional inflammation, whether it's just you are in a state of fight or flight or trauma, and then you get triggered, and then you choose the old behavior, and then there's the loop you're in, right?
Yep.
And that's not necessarily helping you. And there's plenty of people that have trauma that get pregnant, so of course that it's not the only answer. But why in somebody's body does it trigger more inflammation than in another? And I think that comes down to kind of like probably our makeup and just our genetic predispositions.
I don't think I've ever aligned so much with a health professional in my entire life. Like you are sitting here preaching everything that like I talk about and that I believe so wholeheartedly in and that, I've learned so much about these last 3.5 years. And I really hope those of y'all that are listening today, you really take what Aimee is saying to heart. Because again, I don't want you to feel overwhelmed, but if you are sitting there feeling defeated and feeling like you've lost all hope, feeling like you're just going to forever live with unexplained infertility, you're going to forever not be able to get pregnant, whether IVF has failed, IUI, naturally, whatever it is, there is hope. There is so much hope in addressing all these different areas in your life and different treatments you can do outside of just whatever you may be doing or being told is the only thing you can do. There's so much hope for you.
Yes. And that's it too of like hope and fear can coexist. I feel like that's another thing I
Yes.
say a lot of like, again, going back to that, you don't have to be perfect, but just the fact that you're listening to this or trying to educate yourself more, gathering more information, that alone shows me that you have hope. And so just remember that,
Yes.
like, hope doesn't have to be like sunshine and rainbows and like totally
Mhm.
optimistic. I also think toxic positivity isn't great
Right.
for all of us. Like, I don't want to
Right.
shove, mantras down your throat. My spiritual teacher would say, like, your body or the universe hears how you feel, not what you say. And so
Mhm.
getting to that space of like accepting this is hard, this is not where I want to be. And so I'm going to have shitty days, and that's okay. That also, but I'm still here. I'm not just because
Mhm.
I have shitty days, just because I have fear, just because it's been 3.5 years. Am I tapping out? No,
Mhm.
I'm still going to look because I
Mhm.
somewhere deep down I have hope. Call me crazy, but I have
Mhm.
hope. I'm going to figure this out, and so and when it comes to all the things to do, which it is overwhelming and it is a lot, pick one. Do it for a month.
Mhm.
Add in a second one. Do you know what I mean? Do it slow. I also think
Mhm.
community, that's where community and the tribe really helps. Like
Yes.
and you don't really create that community unless you share what you're going through, but some of the online spaces I think are really safe for that, for women going through fertility challenges. But find a buddy or two and
Mhm.
hold each other accountable,
You would
or
be shocked, like, once you begin to open up, how
uh,
so many other people are probably going through it in silence too, or even those that may not be going through it, how they can be such incredible support systems for you.
or that
And of
they went
course
through.
right, exactly. And of course, there probably are going to be people that you open up to and maybe they just don't get it. Maybe they just aren't that person for you, but that's okay.
Yeah,
You learn that, you create that boundary with that person, and you find the people that do want to support you. And again, like you said, it may be one or two people, and that's all
yeah.
you need.
It's all you need. It's
And
all
of
you
course,
need.
finding the people online and the spaces online to be able
Yeah,
to open up and talk about it. Like you can talk there under a username that no one needs to know who
100%.
you are.
Or just like
Right.
I call them like my silent stalkers. Just like look at every post, never like it, never, but just
Right.
follow and
Right.
take it in. I mean, I feel like half of the reels I do these days, not half, probably 90% of the reels I do these days are just like debunking things or
Mhm.
silly to be inspirational, because it's just
Mhm.
it's heavy. And so just
Mhm.
I don't know, just even seeing that in your feed, we're all on social media, seeing that in your feed, I think can really help. Or it also, is like a light bulb goes off of like, oh, like for you with the endometritis, like that could be the thing. Like, I better look at
Mhm.
that. Um, and it's just, it's hard. And I think what's happening right now in the field of medicine, unfortunately, is there's a team of docs. It's very divided where people are seeing there's this whole field of medicine now called regenerative medicine. And we are seeing so much that we can do to reverse the aging process.
Mm.
And that it's more about physiology than it is about biology or chronology, meaning how many numbers of years old we are. And then there's old school dogma, mainstream medicine.
Mhm.
You're over 40, you're screwed. All your eggs are bad. And it's
Mhm.
like they're unfortunately not reading the same research papers, not going to the same conferences. And if they are, it's a full on battle. I mean, and so
Mhm.
I think there's a big change that's happening, like that's in the air. And there will be some of this old school dogma really questioned.
I sure
Like,
hope so.
oh,
And that's a
yeah,
good point too. If you're seeing a doctor right now who doesn't align with you, who isn't advocating for you, who's basically throwing in the towel themselves or telling you you have a 0% chance or whatever that may be, go find someone else.
well, that's it.
Time is so precious.
And time is precious, and also we live in a virtual world now. You could do a
True.
consult with a guy in another country, in another state. Yeah, it
So
might be a
true.
couple $100, but it also might be a game changer for you. You
Yeah.
don't have to be stuck to the one clinic you have in your town, which I work with
Mhm.
women all over the world, my team and I all over the world, and we are constantly connecting the dots for people of like,
Mhm.
and we have some girls, like I just got an email from a girl this morning and she's in Germany. They have very hard rules around IVF. So we got her, she flew to Spain. It's not a big
Wow.
deal. Like over
Yeah.
there, it's very simple for them. I mean, not simple, but simple-ish. Be like us getting on a train to go to DC or something like that up here
Mhm.
from New
Right,
York,
right.
and got seen by a great doctor at a great clinic who was like, yeah, I think you can still do this at 46, and here's why, and this is what we're going to do.
Mhm.
Dramatically, had she just worked with that doctor in Germany, who's now can't see her because she's over the age of 46, she's not getting this
Wow.
baby, right?
Wow.
So
Wow,
sometimes,
wow,
not
wow.
sometimes, I think a lot of the times, it's about the care and you asking for
Amen.
what you need, but you also being resourceful. And that's the beauty of, I mean, this whole world of online and virtual and all of us having platforms. I think it really makes the world smaller, and and then conversations like this where it's like, okay, A, I'm not alone. B, okay,
Mhm.
maybe I'll just DM Adelaide. Who's the doctor you're working with? I'm in the same town. Do you know what I mean? Like,
Mhm.
do stuff like that. Like,
Mhm.
ask for the support. It is there for you.
Absolutely. Absolutely. Well, thank you so much.
Oh,
This has been so phenomenal. I feel like those that are listening get so much out of this. Is interesting because all the different doctors and reproductive endocrinologists and NAPROs and naturopaths that I've interviewed, there seems to be very common themes here that
yeah,
endometriosis is probably in a lot more people than we think.
yeah,
And then also, it's not just one thing that's going to get you pregnant, right?
true.
It really is such a well rounded, you need to come at it at so many different ways. And I remember being the person early on in the journey thinking like, "Oh, I just need the progesterone cream
I
or
know.
I just need to take beef liver or that's going to be the one thing." And the reality is it really is well-rounded. So if you're listening and you're sitting there being like, "I just want to hear the one thing. Tell me the one pill. Tell me the one swap I need
It
to do."
doesn't exist.
Really, yeah, I would encourage if someone's telling you that, I'd probably run. The
I totally
the
would run, and I'd actually report them. I've started reporting
yeah,
certain practitioners. I'm like,
right.
I'm hellbent on it because I'm like, no,
Right.
who are you to say that? It's terrible. Or some people guarantee pregnant.
Oh, yeah. Yeah, it's ridiculous. It's insane. If someone's telling you that, run. It's
I
not
had
true.
one patient just tell me that one of the mindset coaches out there basically was like, "You're the reason you're infertile. It's because of your
Oh.
thoughts." I, I, ooh, I am planning my rebuttal on that, but
Oh
um,
my
it's
gosh.
terrible. Your thoughts are not creating this. I will tell you that right now. And I wrote a book called Body Belief. Your thoughts definitely dictate your behavior, which dictates your health. Your thoughts can be changed. Your thoughts can be limiting. Your thoughts can get in the way, but you are allowed to have bad negative thoughts and still have a baby. So don't let anyone ever tell you that.
Preach, preach, preach. This is
Yeah.
so
It's like,
important. I have
and
women DMing me all the time asking me like, "Am
it's so
I the
sad.
reason I'm not getting pregnant?"
Yeah. And I think there's a book out that says you're the reason you're not getting pregnant.
Oh.
Yeah,
Oh my gosh.
I know.
Okay, well, where can people find you?
Yeah, so my website, aimeeraupp.com, is where kind of everything lives. And then I'm really active on Instagram and TikTok, just giving away as much free information as I can to educate and support. And then anything I create video wise, or do lives or anything like that also lives on my YouTube channel. So there's just a lot to
Amazing.
consume. My books are a great place to start,
Yes.
but you can even just start with my videos and just following me on the gram or on TikTok. And I try to have fun too, to keep it light sometimes, but also having very serious conversations.
Yes. And your gram and TikTok name are just your
Yeah,
name?
just me, Aimee Raupp, or
Perfect.
Aimee Raupp
Perfect.
Fertility. It's one of those. Yeah.
Okay, well, any last thoughts or words here?
No, I think just kind of the message that we're really wrapping up with of be easy on yourself. This process is hard, and it's not about perfection. It's really, I think, about finding what works best for your body, and that means you have to
Mhm.
tune in and you have to listen, which unfortunately, I think the way we were raised and the way society is it's really about outward manifestations
Mhm.
versus inside. And so listening and tuning in. And also when you listen and tune in, listen to your intuition. I think your intuition is saying, there's this baby and it's going to come through. And so
Mhm.
just trust in that process.
Yes, yes. Okay, well, thank you again so
Thank you
much for
so
your
much.
knowledge and everything you do for this community. We are so appreciative of you.
Oh, well, thank you.